So the next set of exercises involve lying down in a supine position, so on your back. And what we're going to want to do on this first exercise is work on range of motion. So you need to have a wand of some type. It can be a cane or a putter, but you're just going to want to take this putter down here, and this is for a left shoulder surgery. So what you're doing is you're assisting with the right side. So now as you lift it up, you're using your right arm to lift it up and to get all the way up to the top. And then we're letting gravity help you work on range of motion above shoulder level with the left side. Now the right side is still in control of this wand, and it'll take it back, and then you take it on back up all the way through. So as Jim does one more exercise, you'll see, so every time as you get better, you're going to be able to go further and further over your head, and this is just another way that we can regain that full range of motion above your head in addition to the other exercises that we've had. This next exercise is specifically for the posterior capsule of the shoulder. We want to stretch that out. This is something that's important in rehabilitation before surgery for some people who are very tight. We see this a lot in baseball pitchers. The problem is what's called GERD, and it's glenohumeral internal rotation deficit, and it's all about the tightness of the back capsule. So this is called a sleeper stretch because you're kind of on your side mimicking sleep. And what Jim's going to do is he's going to pull his arm out. We're going to start out at 90 degrees away from the body. He takes his hand, and as he pulls down, he's compressing his elbow down into the bed. And this stretches this back here behind the shoulder. And he's going to come on back up. Now it's important to do this in 3 different positions. So you'll want to start off in about 45 degrees away from the body, and now he's going to stretch it. And you may do a set of 5 of each of these. Then you come up to 90 degrees and keeping your arm perfectly perpendicular, then you stretch it down. And then finally he's going to come up to about 135 degrees up above here, and then stretch that posterior capsule as well. So this is something that we do preoperatively, but it's also something that we may do postoperatively if you have posterior capsular stiffness. One of the most difficult things following shoulder surgery is gaining what's called internal rotation and being able to reach behind your back. So we're going to start these exercises usually at 2 to 3 months to regain that range of motion. So Jim's going to start, he's going to turn around, he's going to try to get his operative side back. Sometimes you can't get there, so you have to use something like a rod or a ruler or even a magazine to help hold it, and then we start stretching the shoulder blades back. That's going to loosen up those tissues in the front, and as that loosens up, Jim will be able to move his hands closer and closer together on that rod and then keep doing those stretches. Once he gets to the point where he can reach his fingers in his other hand, then he'll be able to do the full parade rest stretch. So I'm going to take that away, and this is really the basic position. So we have our hands together, and you'll see Jim stretching that front rotator cuff muscle. Once this becomes easy, then you move your way up the back. So you go to your mid-back, and you're going to stretch those muscles, and then eventually you'll be able to come up all the way. And then once you're able to achieve this, then you'll be able to reach your hand behind your back and tuck in a shirt or put on a belt or reach into a back pocket. We went through that sequence fairly quickly. It doesn't happen that fast. What'll happen is every day you'll get a little bit more and a little bit more, so that over a period of a month or 2, then you should be able to regain your full motion to get it up behind your back. It's not going to happen overnight, but we want gentle stretching to allow that tissue to start to stretch out and give you the range of motion you need for your shoulder.